Good evening. I'm the last presenter, but definitely not the least, and I acknowledge my responsibility to make this as short and sweet as possible. So let's just dive straight into it. So my study is on assessing the effectiveness and user acceptance of digital health interventions in non-communicable disease management, and it's a systematic review. So I'm Balua Misuri Madigayo, yes, a level 5 MBCHB student. And non-communicable diseases, as we know, they are a major public health challenge globally, and they account for over 74% of deaths on 41 million people annually. And in Kenya, they're responsible for more than 50% of inpatient hospital admissions and 39% of all deaths annually. So it's a huge problem. It's a huge problem, and if we're not careful in the next few years, we're going to have substantial impacts on the economy, on the health sector, and every sector at large. So then what are the strategies that are being employed? What interventions have proven effective in the management, especially factoring in the long clinical duration of the diseases and the debilitating effects of them? What strategies have shown positive outcomes among patients and also healthcare workers alike? So this is just to show you the disability adjusted life years due to the effects of NCDs in Kenya, and they're very shocking. They should be a cause for concern. And so there's need for innovation and digital health interventions. There is a place for technology in this era of smartphones and gadgets. Every one of you here, I believe, came with at least a phone. So they have emerged as promising tools to improve NCD management and empower patients to be able to take charge of their health and not only rely on hospital care to manage their health. So very quickly, we used randomized controlled trials among hypertensives at Magadi Level 5 Hospital, and I had a sample size of 150 patients, aged 18 to 65 years ideally. So randomly, half were assigned with smartwatches, and the other half for the control. And we followed them up for a period of 1 month, and it was noted that the smartwatch group had improved outcomes in the blood pressure readings, in medication compliance, and in general awareness, fitness, and lifestyle changes. So this is just the WHO classification of digital health interventions, and my focus was on 1.4, which is personal health tracking. If I had a little bit more time, we'd have gone into the rest of them, including the health systems management. But in the interest of time, these are the results. So the studies are very simple. There was improved knowledge about the conditions and improved self-management skills, improvement of quality of life, and the most important one that was noted, in more than 60% of those who we allocated the smartwatches was adherence to the treatment, which led to improved outcomes, clinical outcomes. This is just a representation of the outcomes. Could look at it later. So user acceptance and satisfaction of digital health interventions are generally positive. There were high levels of engagement, perceived usefulness, and user satisfaction that was reported among patients. However, there were still gaps in user-friendliness and the cost implications of it. I must say they are not quite affordable to a majority of the population, especially those who receive their care in our public hospitals. So more needs to be done. More needs to be done. And I'm calling on all innovators who are here, everyone in the technology space, the ministry, the policy, the stakeholders, people in positions to implement policy in the government, to take up this as a challenge, to come up with strategies where we could make some of these digital health interventions more affordable and sustainable and used in management of NCDs for improved outcomes of both patients and healthcare workers. Thank you.
So let's clap for all the presenters.